He's the Director of Infectious Diseases at the Mater Hospital. He's back to answer your COVID questions. Hello, Paul.
Hello, how you going?
Look, when this all ends, I'm going to miss you on a Wednesday. It's like our regular date, 9:30 on a Wednesday morning, when we talk about Petri dishes.
Exactly. Now, it's good to get away from what I've been doing all day, every day for a little while, so glad to be here. Thanks.
While we're chatting, 1300 222 612, call now if you have a question for Paul on COVID-19. He's a microbiologist. He's the Director of Infectious Diseases at the Mater Hospital. If you've got questions, call now, 1300 222 612. What do you do all day, every day, Paul?
Well, at the moment, like a lot of my colleagues, we're working really hard to be prepared for the worst. We're hoping for the best still, but we're working hard to make sure that we protect all of our staff as well as be able to care for as many patients as possible when this really hits.
So is that only at the Mater, or are you cross-referencing with other hospitals around the southeast?
It's a big collaborative approach. Obviously, Queensland Health are driving a lot of work at the moment, and we're working with them to make sure sort of our plans line up with them and we can help where we can.
Are we prepared?
I think we've made some good inroads. I think there's certainly some areas we'd like to be slightly better prepared in, but as I said, everyone's working as hard as possible to do our best at the moment.
Queensland's total of confirmed cases is at 743. I say that looking around because the updates are constant. Australia's death toll stands at 20. Are we flattening the curve?
I think the short answer is yes, but I'd really caution people away from over-interpreting that. I think what we can say from the data we've had the last few days is that everyone's working really hard. The measures we've implemented have had an impact, and I think people must be adhering to those to see a slight flattening, but we're not out of the woods yet. And if we take our foot off the pedal, we'll just be right back where we started. So if we keep this up, as I said, what we're seeing now is proof that it works and we can do it, but we need to keep it up.
Interesting to see that yesterday New South Wales delayed their local government elections from September this year to September 2021, so a one-year delay. Last weekend, Queenslanders voted. Some are speculating that there might be a peak in COVID-19 cases in another 9 or 10 days' time. What do you think?
I think there were a number of reasons why that must have gone ahead, irrespective of the current situation. I mean, I think in some ways it was a little contradictory to the messages we're trying to get out to people around staying away and only leaving your house for essential activities. I guess that could have been regarded as an essential activity, but I think it would have perhaps been advisable to have delivered that via alternate means, maybe make it all online or pushing it back if possible. I can only imagine there was a reason why that couldn't happen. And, you know, in terms of whether we'll see peaks from that or an appreciable increase in cases, it remains to be seen. But I guess it's done now. We just need to keep up doing what we're doing now to prevent any further cases.
Paul Griffin, Director of Infectious Diseases at the Mater Hospital. He's a microbiologist, an infectious diseases physician. If you've got questions about hands, faces. I'm always nervous around you, Paul, because I know I touch my face and I shouldn't touch my face. But if you've got questions for Paul this morning on the way that you shop, whether or not you're breathing in other people's sweat as they jog past you, you can call now, 1300 222 612. Or you can send a text, 0467 922 612. Leanne's called in from Deception Bay. Leanne, good morning. What's your question for Paul?
Oh, good morning. I'm 61 years of age and I'm an asthmatic. I had influenza A, a pretty good dose of it, early March. Should I be having my flu vaccine right now?
The short answer for everybody is yes. Yes. I mean, although we could speculate around some protection from having just had the flu vaccine, depending on your age and which one you get, has 3 or 4 different strains within it. So it'll give you protection from the other strains that are still circulating. So I'd strongly advise basically everybody to get the flu vaccine. And it's important to stress the flu vaccine doesn't protect you from COVID, but it is our single best way of protecting you from the flu. And getting the flu while we're struggling with the COVID situation is a burden on our healthcare resources that we don't need, but also evidence suggests COVID and flu together is definitely not good. So I'd encourage everybody to get the flu vaccine.
Get your jab, Leanne. Do you think, Paul, that there could be fewer cases of the flu this year because we are so conscious of hygiene?
Absolutely. So the thing to remember about all this social distancing and hand hygiene and all these things, this is what we've wanted people to do for the flu forever. So it will certainly help the flu this year. But I just don't want people to be complacent and distracted too much that they don't get the flu vaccine, because it's going to be a really important part of our public health interventions moving forward this winter.
Are there fewer cases of gastro at the moment?
I haven't seen any data to support that, but I would absolutely think that's the case for sure.
Human beings are so gross, aren't we?
Absolutely.
Susie's in Ipswich. Susie, what's your question for Paul?
Hi, good morning. We are struggling to get alcohol-based hand sanitizer to protect our staff. We have been offered some that is non-alcohol based on quaternary ammonium, but I'm unclear as to whether that is of any good to us in this current situation.
Yeah, the thing to say about hand washing is, good old soap and water is still an option as well for everybody. In terms of
Unfortunately, some of our staff are on the road and they don't
Sure.
always have that, so we need something available to them in those other instances.
Sure. There are a lot of alternate suppliers of hand hygiene products that are alcohol-based coming online now, different breweries and other things and distilleries that are now switching to manufacturing that, which is great. So I think the supply issues there are improving. In terms of that product, I can't comment specifically without having seen it. Alcohol-based products are the ones we have the most evidence for and the most support for at the moment. But in the absence of being able to get that, anything's better than nothing.
Yeah, okay.
Susie, can I ask what industry you work in?
Food distribution.
Right. It's so important. It's such a priority. I'm just trying to think if there's someone you can go to, and whether it's someone in government or whatever to say, they say every job's essential. You want to keep doing your food distribution job, but if you can't get the sanitizer, what a conundrum.
It's tricky because Singapore and America have some of these products listed on, but all of our Australian information only say alcohol-based, and so I'm sort of caught in the middle of the only thing that I can currently get doesn't actually meet our... and we're waiting for the alcohol-based stuff to arrive, but I don't know how much faith to put in the products that we're able to get our staff at the moment.
Yeah, we are seeing a lot more of those alcohol-based products come online, as I said, from those alternate producers locally. So I'd encourage you to have a good look for some of those because even on the weekend there was a whole lot more online that have some available now. So hopefully you'll be able to get some.
Susie, thank you. So does that mean that are there some dodgy hand sanitisers being flogged around the place too, Paul?
There are, unfortunately. So there are some sort of cheaper knockoffs, I guess. But as long as it's, we want people to have 70% alcohol-based hand sanitisers, and that will do the job. Metho
in water, though, too, is another option, isn't it?
People are using that. That's may not be ideal on your hands in terms of the drying effect and other things. So yes. I'd encourage people to get a reputable product if at all possible.
Paul Griffin, the Director of Infectious Diseases at the Mater Hospital, live on ABC Radio Brisbane this morning and on the ABC's Facebook page as well. If you want to see Paul face-to-face, check him out online. And that means also that video will sit there on the ABC Brisbane Facebook page if you've just tuned in or you can't stay for the full session or you want to share his answers with other people. Check out the ABC Brisbane Facebook page. There's a live Facebook feed of Paul right now in studio. Margaret is in Nathan with a question about masks. Go ahead, Margaret.
Good morning, Paul. If I want to make masks myself, how many layers of cotton should I use?
Oh, that's a tricky one. So it's really hard to say. Obviously for masks for use in healthcare, we want them to be, CE marked, TGA approved and all of those sort of things. So it's a different environment when we're talking about making our own masks. And, we have to, there's some question around the benefit of masks in the community and the current evidence and, reiterated by the WHO on the weekend suggests that mask wearing in the community shouldn't be a focus right now because it unfortunately leads to complacency and people maybe not doing the other things that they need to do. It's a bit of false reassurance, but in short, it probably doesn't matter how many layers, to be honest, and it's a bit of a balance between comfort and if you can actually wear it or not, depending on how thick it is. So,
Margaret, are you just making it for yourself?
Yes.
Yeah.
I didn't know whether to have 2, 3 or 4 layers of cotton, that was all.
Yeah, probably 1 or 2 would be fine. But as I said, what we don't want is that mask wear in the community replaces people doing social distancing and hand hygiene and the things that we're really trying to get people to do.
Paul, lots of questions coming through for you on Facebook as well. Let's rip through a couple of those. Kim says, are we expecting COVID-19 to get worse over winter?
Yes, basically. We're not sure of the role temperature will have in this, but basically just the timing. It's going to get worse from here. So, yes, it will be worse in winter.
Why?
Again, we don't really know the role of temperature and humidity and other environmental conditions completely, but just for us it'll be a timing thing. So, we're probably 8 to 10 weeks away from this really hitting potentially, so that will coincide with winter.
Georgina says, should hairdressers be open?
A tricky one, and whether it's defined as an essential service or not. And I think people have to keep in mind that all of these decisions are a balance between the obvious infection control and public health things we want, but also the ability of the population to go on without those things for 3 to 6 months. So I think if hairdressers can adhere to those basic principles around social distancing, so not have too many people there and not be there too long and wash their hands, I think it can be done safely, but I think that's going to be something that's going to be continuously assessed.
Seeing a lot of blokes shaving their heads, Georgina, maybe give it a crack. Veronica wants to know, can the virus be spread through air conditioning in the car, in offices, in shops?
Short answer is no. So the big difference between droplet and airborne. So this one is what we call droplet, which is where you cough or sneeze, or to a lesser degree when you're talking, produce these slightly larger particles, and they only travel a relatively short distance. So that's where the social distancing really comes in. Airborne is things like measles that can travel. They're really tiny particles that can travel through air conditioning. So COVID cannot do that, which is good.
Pam, good morning. She says, is tea tree oil good for disinfecting things?
Probably yes. So it's not something that we have a lot of medical grade evidence for in this particular virus, but it's widely believed that it has antiviral properties. So yes, basically. I mean, particularly in healthcare environments or other public facing places, I'd probably recommend a slightly more evidence based. So a bleach type product, for example, but it probably works.
Smells nice too. Richard is in Hendra. Richard, what's your question for Paul Griffith?
Hi, Paul.
Griffin, sorry.
My question's really around treatment trials, which we know are underway, and if you had an update for us on how they're going.
Yeah, great question. So there's a lot of work happening in treatment trials, and I think I'm involved in around 6 or 8 of these myself, and we're all working hard to try and find a good treatment. I think some recent reports probably overstated the evidence to date on a lot of those. So we don't have a cure, definitely at this stage, but we've got a lot of promising preclinical data, and we're going to trial as many things as we can. The best thing about this, though, in terms of intervention, is prevention still. So all those measures around social distancing and hygiene are going to be the way we get on top of this. We don't really have a therapy that works as well as we'd like just yet, but we're trialling as many things as we can. Great
question, Richard. Thank you. So when are the first human trials of the vaccine here in Brisbane?
So we'll probably be trialling a couple of vaccines, or I'll be trialling a couple of vaccines probably in the next 6 or 8 weeks. We'll commence some of those. So, yeah.
Okay, so what are we? April, May, June-ish.
Yep.
We'll say around there. But, of course, the vaccine is not relevant to the treatment of this particular pandemic, hence the hand-washing message. Gareth is in South Brisbane. Gareth, you're a sales rep. What's your question for Paul?
Yeah, Paul, I just want to find out, being a sales rep in supermarkets, we're working really hard to try and keep essential products on the shelf for customers. Now, I've done 2 things. I've started wearing a mask so that I'm conscious about not touching my face after touching surfaces. And I've also bought a jerry can from a warehouse and I wash my hands with antibacterial soap after each call. The question is wearing the mask going to reduce the likelihood of infections because I'm moving around Brisbane so much?
Good question, and basically the short answer is no. It's a bit of a complex one. So, and again, this is coming right up from the WHO, who released another statement around mask wearing in the community on the weekend. That the masks that people are wearing probably don't really protect them, and the risk with mask wearing is that people become complacent and don't socially distance and don't do their hands and all those things. If you maintain your activity and your vigilance with those other things, the mask might help a little bit in that it is a physical barrier between touching a surface and touching your face. But if you do your hands well enough, that's not really an effective means of transmission anyway. So the short answer is it probably doesn't help that much.
Good on you, Gareth, and thanks for keeping the shelves full. Liz is on the Gold Coast thinking about salt water. Hello, Liz.
Yeah, good morning, everyone. Yeah, I was just reading, I've sort of done a bit of looking into mask wearing because I sort of do believe that it probably does help. Read an article the other day that said even a tea cloth mask, homemade, would help twofold because I'm thinking the virus sort of lives mostly in the upper airway before it travels down. And then the other thing I was reading was there's a salt-impregnated mask that denatures the envelope of the virus. I was just wondering if you could clean with salt water instead of all these other harsher products.
Again, it wouldn't be the first product we'd recommend people clean with. I mean, we're recommending bleach and other similar sort of products for this, but again, it may well have some activity and it's difficult to know because it depends a lot on different concentrations and all sorts of things. I'd recommend bleach, though, is probably the best thing, particularly for, as I said, healthcare environments or food production and those places where that sort of cleaning is critical. Around the home, you could potentially experiment with some of those things, but as I said, the bleach and those sort of products are the ones we have the best evidence for.
Thank you, Liz. Still on salt water, Steve in Annalise says, can the coronavirus live in salt water?
Probably not. So, yeah, and obviously the dilutional effect of seawater, it's not going to be an effective way of getting it if you're out in the sea, but it probably doesn't like that environment very much.
Craig wants to know whether mosquitoes can spread the disease if they bite an infected person and then others.
Yeah, we really don't think so. We've got a lot of infections that are mosquito-borne that we know can readily be transmitted through mosquitoes, but it doesn't appear to be a significant source of transmission for this.
Well, that's good news. Yeah, because I was thinking, Ross River virus or malaria, but not COVID-19.
Not really, no, that's right. This is droplets, so this is a respiratory thing. So, this is something that people cough out or to a lesser degree when they're talking, produce these droplets, and then people touch those and touch their mucous membranes or breathe those in, and that's how it's transmitted. 1300
222 612. You can call now. Paul Griffin will be here for the next 10 minutes. He's the Director of Infectious Diseases at the Mater Hospital, answering your questions live on ABC Radio Brisbane and on the ABC Brisbane Facebook page. Back to some Facebook questions. A specific one from Adam who says, how does COVID-19 react to people with G6PD? It's a blood deficiency.
So the relevance of the G6PD is around some of the therapies that people are proposing. So the hydroxychloroquines and the chloroquine, for example, that may be relevant there. In terms of people with G6PD deficiency, we don't think that's going to have a significant impact on susceptibility or severity of infection if they do get it. But again, we're still relatively early in this, and I know we've been saying that for a while now, but we're still less than 4 months in, so whether that does have an impact, it's not been borne out yet.
Thank you, Adam. Raylene says, when are we going to start testing for community spread?
So we have, basically. So the testing has evolved as we see the transmission dynamics evolve.
But my question is, for the children who might be carrying the virus as asymptomatic or with mild symptoms, are they human incubators transferring the virus?
So good question, because that's a huge problem with the flu, but we don't think that's a significant problem with COVID. So not only are the children spared from clinical disease, so if they get it, they're pretty mild. We haven't seen a lot of child-to-child transmission. So it's been something that's been looked at really carefully, and if we had, we would have shut schools earlier. So kids aren't just asymptomatic. They don't seem to be reservoirs or super spreaders like we see with some other viral infections.
Barry's at the Gap with a question that keeps recurring every week when we have you on, Paul, but it means that more people still don't know the answer to it. Barry, good morning. What's your question?
Oh, good morning, Paul. Good morning, Rebecca. I was just wondering how long the virus can survive on various surfaces, for example, on skin, steel, plastic, cardboard.
Yep, great question. So worst case, so on hard, shiny surfaces, probably up to 3 days, but that's not that it's still there at that same amount at just under 3 days. It kind of goes away over time, so about half of it will be gone in about 15 hours. On skin, the really good thing about this, and relates a lot to some of our personal protective equipment and other things, on skin it's probably 5 or 10 minutes, so it's not that long. So hard surfaces that it kind of likes, it can stay there for up to 3 days, but skin's a bit less. And things like sunlight and the temperature and other things like that have a bit of an impact too.
Someone asked Dr. Carl last week after we'd had you on, could it survive on the skin of fruit?
Possibly, and it's, again, something that's talked about a lot. We don't think that's a really significant way of it being transmitted, though.
Linda, good morning. She says, I work in retail in a major hospital. We get mixed feedback regarding if gloves and or a mask would be a good safety measure for our staff behind the counter. We are also running out of hand sanitizer. Should people who work in retail wear gloves, Paul?
Probably not. So I think it's really clear that the personal protective equipment really should be for people that are looking after someone who's sick with this. So whether it be caring for them at home or in a healthcare environment, that's where the PPE is critical. And, we wear that all day, every day when we're seeing sick patients. But in the community, it has very little role. And again, unfortunately, the downside of it is it can lead to complacency and people don't wash their hands and do those other things well enough. So in the community, the simple answer is do the social distancing and wash your hands.
Tom has called in from Toowoomba. Tom, good morning. What's your question for Paul?
Yeah, good morning, Paul.
Hi.
We're currently an essential service provider and we work with a lot of AMS services, and we're currently working with the health authorities to set up some urgent clinics, obviously, given the current events. But my question is, there's been a lot of concern and speculation, especially from the general practitioners that we've been working around the mutation potentially of this virus. As we know, this is the current strain that's out there, but what's the potential or what's the research that's being shown with flu vaccines coming into play now and with the flu season pending, that this virus could actually I suppose, regerminate into a new strain down the track?
Yeah, look, tricky question. We haven't confirmed that there are multiple strains circulating, but part of the reason we're in all this mess to begin with is these viruses do like to change readily, and this is a virus that's probably been around for a long time in some kind of animal, and through some mutations it kind of gained these abilities that make it so successful from a virus point of view, in that it's transmissible in people and it causes a mild disease in most people but a severe disease in a certain few. So it's quite possible that it could mutate, and there's speculation there may be 2 or 3 strains circulating. The good thing is they seem similar enough on the surface that hopefully a vaccine will cover all of those. I don't think we should be too concerned at this stage we'll see another new coronavirus, because obviously we've only really been in this situation 3 times in recent times, with SARS and MERS and now this. So I don't think we need to start thinking about the next one. I think the focus now is on all those interventions to control this one, which really is all that hand hygiene and social distancing and all that sort of stuff. And with the flu, we know the strains that are circulating. We monitor that really closely, and the vaccine will do a good job of helping with those.
Thank you, Tom. Paul, Mags in Miami on the Gold Coast says over the last day or two she's noticed a decline in the number of people walking, running, cycling along the beachside parade there. Although it's interesting because I reckon in Brisbane people are seeing more people out walking the dog, because it's like your one escape for the day for people who are isolating. If you walk past someone and you can smell their perfume or their deodorant or their sweat, are you breathing in some of their germs?
Possibly, but hopefully not enough to get infected. So with the droplet spread, we know that you need a fairly significant interaction to be susceptible to getting this. And, the public health definition is 15 minutes of face-to-face or 2 hours in the same room. So clearly if you walk past someone, that's a lot less than that. But we also know, being out in the environment, the wind blowing and the sunlight also reduces that. So I'd certainly encourage people to get out as long as they're adhering to all those things that we've heard a lot about. So just with your family or with one other person only, and stay away from other people. And I guess what we don't want is people go out exercising and then congregate in a big group and spend time chatting or get a coffee or whatever together, which is a risk.
Yes, actually we're going to talk to a cafe owner who's a bit concerned about that after 10 this morning. We've only got 3.5 minutes left with you, Paul. Let's see how many questions we can get through. Ian is in Birkdale with a vaccine question. Go ahead, Ian. Ian, are you there? He's not there, but I know what his question is. Is the pneumonia vaccine effective against the virus at all?
No, unfortunately.
Marley's at Harvey Bay. Marley, good morning. What's your question for Paul?
Good morning. My question is, if you've been tested positive for the virus and you stay home for 14 days, how do you know? Do you have a test to make sure that you are clear?
We were testing people to clear them. We're now not. So if people are at least 10 days since the onset of symptoms and completely asymptomatic for 3 days or more, the public health definition currently is that they'll be cleared and able to return to the community while still doing all the right things, social distancing, etc.
All right, I'm just going to read out some quick questions to finish. Elaine at Tarragindi wants to know if it's okay to get a plumber out at the moment.
It is. So obviously, provided someone's not in isolation because they're positive or quarantined in that house, and that you do all the right things in terms of hand hygiene, for sure.
Someone on text says, how many coronavirus people are in Queensland hospitals?
I'm not sure people that are admitted at the moment. I mean, obviously there's quite a few positives and those people are managed through their local hospital or health service until they're clear. But, I couldn't tell you how many are currently admitted.
Yeah, and I'm loath to quote the figure because it changes daily. What we do know is at the moment, Queensland's total number of confirmed cases, 743. Kathy says, is ibuprofen safe to take in relation to COVID-19?
We think there's some evidence that may be not good to have with COVID-19. So a lot of people are recommending paracetamol over ibuprofen or Nurofen type things for those symptomatic relief. So you probably steer clear of the Nurofen, to be honest, or the ibuprofen.
Brilliant. All right, Paul, as always, more questions than we have time to answer. What are you going back to work to do now?
More of the same, making sure we're as prepared as we can be.
We'll stay in touch. Shall we do this again next week?
Sounds good.
Paul Griffin, who is the Director of Infectious Diseases at the Mater Hospital. If you missed the first part of his Q&A session, it is online right now on the ABC Brisbane Facebook page. The video will be sitting there. You can watch it. You can share it. Always good to get reputable information out to the community.
This is ABC Radio Brisbane.